Welcome to Module 2 of the Tobacco-Free Futures Implementation Series, Resource and Support Planning. Tobacco-Free Futures is an integrated health systems tobacco cessation model developed for Alberta Health Services to provide support for Albertans who use tobacco products. This module refers to the content found in Chapters 7 to 9 of the Tobacco-Free Futures Guidelines. During the resource development phase, the implementation processes related to all levels of treatment must be considered, including determination of the staff roles, standards for documentation, availability of pharmacotherapy, and standards for print resources for patients or clients and staff. Treatment in or admission to a healthcare facility provides an important opportunity to support temporary and long-term tobacco cessation. The majority of tobacco users would like to quit, and when patients are admitted or treated for smoking-related illness, they are often even more motivated to overcome their addiction. Every tobacco user who expresses the willingness to begin treatment to quit should be offered assistance. Brief interventions of 1 to 3 minutes can be effective, and healthcare providers should offer these whenever possible. There is, however, a strong relationship between the length of the session and successful treatment. Intensive intervention counseling sessions are most effective in helping tobacco users quit and should be offered at every available opportunity. As we said in Module 1, research supports using the 5 A's approach by healthcare professionals in any setting to identify and provide at least minimal support for every tobacco user to help them become tobacco-free. The first step is asking all patients if they are tobacco users. Tobacco-Free Futures has developed a standard care pathway that can be modified when appropriate for specific care settings, such as home care and public health. This information can be found in Chapters 16 and 17. This pathway and the associated forms and resources to help staff systematically identify, document, and treat tobacco users are outlined in the Tobacco-Free Futures Guidelines. The care pathway guides staff through the 5 A's. The good news for tobacco users and the healthcare providers working with them is that even a brief prompt with limited counseling can lead to a quit rate of 3 to 13%, and more intensive intervention that includes follow-up sessions can lead to a 13 to 40% quit rate. As part of the Tobacco-Free Futures initiative, it's important for you to make decisions regarding staff roles, including who of your staff will be expected to perform brief tobacco intervention as part of their day-to-day practice. Your site will also have to decide if you have the capacity to provide more intensive tobacco counseling internally. If so, which staff will be expected to provide this service and to whom?
What level of treatment they're going to offer, they then need to decide which staff within their facility are going to provide that level of treatment. So is it all frontline nursing staff that are going to be expected to do brief tobacco intervention as part of their role? If that's the case, the site needs to make that call. If they're going to offer intensive treatment, then sites sometimes look at different options for doing that. We've had some sites that have decided that their respiratory therapists are going to be trained to offer a more intensive level, and that if a patient comes in who's got a little bit more complex needs some more support other than the brief tobacco intervention at that time, that a referral can be made to respiratory therapy. That's just one example, and again, that might not work for every site.
When on-site intensive counseling is not available, patients can be referred to other supports, such as the AlbertaQuits group of services, which includes online, phone line, and group sessions. AlbertaQuits.ca is an online service which offers interactive, self-guided tools to help tobacco users stop using tobacco and begin to lead a healthier life.
All Albertans are eligible for the AlbertaQuits.ca service. This is a tobacco reduction service that is open to anybody. It's free of charge and is totally accessible through either a mobile device, your desktop, or anything that connects to the internet. All you have to do is type in www.albertaquits.ca. If a person registers with the service, then they'll have access to some certain cessation tools that not everybody sees. So some of those cessation tools would be things like how to quit, how to plan for the quit, things like getting extra support through emails or text services. So it all depends on how you want to proceed with your journey. The AlbertaQuits online service is totally customizable depending on how you want to use it. So if you want a little bit of support, then you can ask for a little bit of support. There's online experts that they can talk to that'll give them extra support. So it depends just on how the person wants to access it. This is an excellent service for people who don't want to come in or want to talk to somebody on the phone, so they can access the service through the comfort of their own home or on their mobile device. Realizing that there are a lot of other tobacco-related websites, what makes AlbertaQuits.ca unique is that it is Alberta-based. It is the portal for if a person or a healthcare provider wants to get help for their patient. We provide an access point. So whether the person wants to get help through the online service or access to some of the AlbertaQuits groups or even the helpline, they can start here. We have evidence-based information that is unique to Alberta and provides quick access to all of our services.
The AlbertaQuits helpline is a phone service provided by professional, trained tobacco counselors and is available free to all Albertans.
The AlbertaQuits helpline is a free, confidential, non-judgmental service provided by trained cessation counselors, providing support 7 days a week from 8 till 8. With the AlbertaQuits helpline, they're able to help people who are interested in quitting smoking, developing that personalized plan, helping deal with those cravings that come up, as well as triggers. And not only that, sometimes we need a little bit of extra motivation, so they're there for that support. And there's translation services available up to 180 languages to help support anyone along that journey. As a healthcare provider, you are able to share this information about the resources that are available to help them quit smoking or reduce their tobacco use in general. And with that, we set up a number of callbacks for the clients to help them along their journey, to ensure that they stay motivated, help them deal with any triggers and cravings. And if for some reason they get off track, we're still with them. We're here to support them no matter where they are.
The Alberta Quits group counseling program is called QuitCore. These sessions provide participants with an opportunity for participatory shared learning and group support during their journey to become tobacco-free. The groups are led by trained healthcare professionals.
QuitCore was set up to offer folks a small group support program when they're looking to either reduce or quit using tobacco. There are people who enjoy that opportunity to get group support. They get together usually once a week, might be in the afternoon, but it's often in the evening. There's 6 sessions that are offered. The participants from week to week connect and provide encouragement to each other at the same time as they're working through their own journey to make changes in their tobacco use. It's an Alberta Health Services program, and we provide the training, the manuals, the resources, all the tools to do QuitCore. And that means we work with facilitators that may be with Alberta Health Services, but we also partner with primary care networks, and their health professionals may be involved in offering QuitCore. It's available in, right now, up to around 20 communities, and we're always working towards identifying more professionals that can offer it and others. We haven't mentioned yet, QuitCore is free. There's no cost for people to attend. If they want to find out if QuitCore is available in their area, then basically it's as simple as a call to the helpline, and they can connect them to the folks who do registration, and they'll be able to chat about when QuitCore is going to be offered next. If we're getting requests to attend group from a community that doesn't have QuitCore yet, then we look for partnerships with health professionals in that community to offer it.
The primary care network in your community may also have programs and services to support clients who use tobacco products. Some PCNs may offer QuitCore group sessions and/or one-to-one counseling. Primary care networks across the province, supported by the Towards Optimized Practice program, are implementing an approach similar to Tobacco-Free Futures called PCN ACT.
An ACT initiative, or Primary Care Networks Acting Collaboratively on Tobacco, is a customizable approach to addressing tobacco dependence at primary care using a 5A algorithm and a team approach. I think the important part of that is the continuity of care, is that the patients are getting the same message when they're an inpatient as they are when they go back into the community. So hopefully that what will happen is maybe they've been treated as an inpatient for with cessation meds or nicotine replacement, and when they go back out to their primary care clinic as a follow-up after being an inpatient, they're asked about their tobacco use. So it's kept an area that's important, and the treatment, we're using the same information Tobacco Free Futures is using, so we know that that what we're telling patients in the community is what they've been told as inpatients as well. So it just really helps them understand that they're getting the same message and there is less confusion for the patient. Having it as a priority, I think is very important.
It's also essential for staff to document their tobacco intervention activities with clients. Standardized AHS forms have been developed for this purpose and are available through the AHS Forms Library. They include the Tobacco Dependence and Cessation Brief Intervention Form, the Tobacco Dependence and Cessation Consult Form for more intensive counseling and cessation planning, and a fax referral form to AlbertaQuits.
Because tobacco use affects the whole entire body system, I strongly believe that it's just as important to document tobacco use as you would a vital sign. Documenting tobacco use is key. Although not every patient is ready to quit, the risk of withdrawal is always there. So we need to be able to manage that in the acute care setting and just help support the patient.
Those most likely to benefit from intensive counseling interventions are people who also have a more difficult time quitting, including those who are more heavily addicted, those with concurrent disorders, people from deprived socioeconomic groups, and those who live with others who smoke. Whenever possible, intensive tobacco cessation programs should consist of 4 or more sessions, with each session lasting longer than 10 minutes. When people make significant changes to their lives, they experience similar cycles during the change process. These cycles will change from one person to another. While one individual may go through the cycles in a linear fashion, someone else may go back and forth and experience them several times before achieving success. Patients at your site may be at different stages of change, ranging from those not ready to quit, those who are ready to quit, and those who have recently quit. Those not ready may only accept temporary support to alleviate withdrawal symptoms while they are confined to a tobacco-free environment. Those who have recently quit may be at high risk for relapse given the stress of their personal circumstances. Your staff should be prepared to assist patients based on their individual needs.
As a respiratory therapist, it's part of our duty to discuss respiratory care and smoking cessation with our patients. So I think it's definitely one of the priorities that we need to talk to when it's appropriate for patient care. I've personally had heard a lot of success stories, some with patients who've returned to the hospital for other reasons, and if I go and talk to them mention the smoking cessation, they'll come back with information about that they've received prior to in other admissions in the hospital, or people who've mentioned that they've quit smoking through certain avenues because of a recent admission. So it's great to hear.
Quitting smoking is incredibly difficult, and withdrawal symptoms may be intense. Often, using pharmacotherapy on its own doubles a person's chance of successfully quitting tobacco. Nicotine replacement therapy, or NRT, is also helpful in aiding people while they go through the symptoms of tobacco withdrawal. When clients are hospitalized and temporary cessation of tobacco use may be enforced because of their illness and the smoke-free environment, NRT may be especially helpful. Many myths persist regarding the effectiveness, adverse effects, and counterindications for cessation pharmacotherapy. Providing up-to-date information for staff and patients will support effective use of these products.
In addition to the order sets for pharmacotherapy, pharmacy services were also involved in development of the guidelines specific to the pharmacotherapy piece, as well as standardized patient education sheets. Standardized resources are tools to help translate the knowledge from evidence-based guidelines into everyday practice. So they're used to help support patients along their journey to quit using tobacco. They also ensure that the same resources are maintained, they're current and accurate and accessible to clinicians in a variety of practice sites and locations. So pharmacotherapy in combination with behavioral therapy has been shown to double or even triple the likelihood of long-term cessation. I have encountered a number of patients as well as colleagues and members of the community that are interested in quitting smoking, but they are concerned about nicotine replacement therapies, and they think that they may become addicted to these as well. And they think that quitting cold turkey may be a better option. So generally I explain to them that the amount of nicotine and the speed at which it's delivered varies dramatically from between a cigarette and a nicotine replacement therapy type of product. And eventually the dose will be gradually decreased and discontinued. As well, the nicotine replacement therapy, unlike the cigarettes, does not contain the thousands of other hazardous chemicals and carcinogens. It's simply nicotine with no other additives. So the literature has shown that nicotine replacement therapies are generally well tolerated. They're considered safe and effective. And we know that withdrawal symptoms and cravings can occur quite quickly, especially if it's a stressful time for them. So within minutes, peaking in 24 to 48 hours. So in order to help reduce symptoms of withdrawal and to keep patients comfortable in our process, when we assess and advise patients, we can also arrange for some form of pharmacotherapy support, generally in the form of nicotine replacement therapy. In AHS, we do have all first-line pharmacotherapy agents included on our formulary. So this includes the nicotine patch, inhaler, gum, lozenge, mouth spray, as well as the prescription options, which are bupropion and varenicline. As a pharmacist and a healthcare professional, it's my responsibility to assist patients who are using tobacco products. It's the number one thing I can do to help prevent the risk of heart disease, cancers, stroke, and a number of other ailments secondary to tobacco use, and I believe that it may be even more effective than any medications to treat these conditions. So I think prevention is key.
To help clients to quit and to remain tobacco-free, it's important to assess nicotine withdrawal symptoms, which for many can become overwhelming and result in a return to tobacco use. To prevent relapse, providing pharmacotherapy can be essential. Your site will need to ensure that pharmacotherapy is stocked, staff is trained regarding the correct use of products, and client information is available. More detailed information on the products available through AHS formulary is available in Chapter 9 of the Guidelines. Standardized AHS cessation pharmacotherapy order sets for initiation and follow-up discharge have been developed and are available through Forms Management. Health professional and patient print product information are also available. Quitting tobacco can be one of the most difficult challenges a client faces. By beginning with a brief intervention and then moving on to more intensive intervention if wanted and needed, you can help your patients to stop smoking.
As management, we support our staff and we encourage our staff to constantly have those conversations with people, just so that you're not missing that window where they say, you know what, the time is right, I'm ready to quit.
Take a positive approach and a real encouraging approach with patients, where this isn't a judgment call. This is about, you trying to help them with their health care. And I found that has really I found a lot of receptivity with patients when I do speak with them about that, and that they are appreciative that someone is caring about their health.
One of the key things to think about is don't come across as the white coat and as the expert telling them what they need to do. Come across as somebody who's there as an offer of support for somebody when they're ready to make a change. And basically you're connecting them to something that will provide service or support to them when they're ready to make a change that they're choosing to make. So you're not telling somebody what to do. You're not pushing them into anything. You're just offering that non-judgmental, empathetic opportunity to access support when they're ready. And that's always a good thing.
If you're ready, let's move on to Module 3, which will focus on preparation of staff through training and communication tools.